Hello and welcome to another session of Close Calls with California Poison Control System. I'm Dr. Race Vora, Medical Director with the Fresno Madera Division of California Poison Control, joined by my co-host, Dr. Cyrus Rangan, also with California Poison Control, and Dr. Riku Moriguchi with the University of California, San Diego, where he's an emergency medicine specialist and also a fellow in toxicology with the San Diego Division of Poison Control. Welcome, Riku. Thank you for being here.
Thanks for having me.
Our topic today really touches on this larger epidemic of opioid addiction and overdose. And we really wanted to focus on a substance called Xylazine. This is probably a new term for a lot of our viewers. So we wanted you to share with us what exactly is it and why and how is it causing harm in the street drugs?
Yeah, so Xylazine was actually initially developed as a drug for high blood pressure in the 1960s, but because of its sedating effects, it was never put on the market. But since then, it's actually been used in veterinary medicine, primarily in horses. And the reason we're talking about it now is that since the mid-2000s or so, we're seeing reports of increased detection of Xylazine in the illicit drug supply. And primarily now we're talking about fentanyl. You may have been hearing it referred to as tranq or tranq dope. And in general, what it does is it reduces the fight or flight response of your body. It could be sedating, it could be slowing your heart rate down, lower your blood pressure, reduces your drive to breathe, all of which can be dangerous in overdose. There are medications that we use in humans that are similar in mechanisms, some called clonidine, dexmedetomidine. There are several reversal agents that are used and studied in animals, but none of are approved in humans, which also adds to the dangerous effects of it.
So in our experience in poison control and in the emergency departments, we're seeing that patients are coming in with opioid overdoses along with Xylazine, that these drugs are actually being bought and sold in combination on the streets. So could you talk a little bit about the kinds of symptoms that we expect with this combination, especially in patients who have severe symptoms, and what contribution that the Xylazine may be playing in death cases?
Yeah, and that's an interesting question. I think one of the tricky aspects of this is that in overdose, both Xylazine and fentanyl present very similarly. They both have small pupils. They can have sedating effects, so they might not wake up when you try to wake them up. They might not be able to breathe on their own. And all of that overlays between both Xylazine and fentanyl. Some of the different effects might be that Xylazine generally does not respond to the reversal agent called Naloxone, or you may have heard referred to as Narcan. The additional thing is that Xylazine probably acts a little bit longer than fentanyl, and especially when it's not responding to the Naloxone, you might be seeing patients that are not waking up for a much longer time than you would expect with fentanyl overdose.
So given the fact that Xylazine is not something that we can easily test for in the emergency department, one clinical clue to a clinician might be that if we give Naloxone to a patient with apparent opioid overdose and they don't seem to respond as expected, that maybe Xylazine is responsible for that lack of response.
That's right. That's a consideration for sure.
There's a concerning dimension to some of the Xylazine cases that have been reported in the medical literature. And that is that a lot of these patients seem to have pretty severe injuries to the skin, the muscles, and the soft tissues. This seems to be a little bit different than what we're used to seeing with some of the other opioid overdoses. We're going to share a picture that's a little bit graphic just as a warning to our sensitive viewers, but I think it's important for us to talk about this issue in the course of this conversation. So tell us what we're looking at with this clinical image, and what are some thoughts about, exactly what's the cause here?
Yeah, so this is an image of a wound in someone who reportedly used fentanyl that was adulterated with Xylazine. And these ulcerations and necrotic wounds have been described when it first was found in drug supplies in Puerto Rico in the 2000s. In general, when we see wounds like this in people who use drugs, we tend to see these wounds develop in areas where they're reporting the injection and primarily in the arms. What's unique about Xylazine is that there are reports of these wounds popping up in places where they're not actually injecting. And the reason these wounds might be developing is not clear yet. It might be an inflammation of the blood vessels called vasculitis. It might be that people are injecting more frequently. But what's interesting is that these wounds don't develop when they are injected domestic of animals. So it may just be that people need better access to clean supplies, clean needles, clean water, stable housing. And that may actually reduce these wounds as well. But we do know that these wounds are quite debilitating and reduce someone's ability to function in society.
So given the wide range of clinical findings that these patients may have, what would you say are the most important takeaways for the public to know about xylazine, especially xylazine in the context of fentanyl and other opiates?
I think there are a few important takeaways. One is that the use of any sedating medication or sedating drugs like fentanyl or xylazine that depress your drive to breathe is really dangerous, especially in an unmonitored setting. We do know that the detection of xylazine in fentanyl supplies is increasing. So I think if you're using any drugs that are not controlled by a pharmacy, you should expect that xylazine may be in that supply. And I think in general, the important thing that I want some clinicians to take away is that we know that naloxone or Narcan is a reversal agent that works with opioid overdose. And while you may see a lot of media coverage about xylazine, we know that fentanyl is still continuing to kill people at an alarming rate. And we know that there is a medication called naloxone that helps with that. So I think if you see someone that is clinically looking like they might have overdosed on fentanyl, you should still be treating them with naloxone.
Tell us about the naloxone. I mean, FDA has approved it now for over-the-counter, which is good news, but we still don't have enough people using it. I think you were able to cite a study that only about a third of overdose deaths had naloxone attempted. Is that accurate?
Yeah. So there was it was a recent study that looked at post-mortem data. So people who have died, unfortunately, from opioid overdose. And the general messaging from that was that the detection of xylazine has been increasing in people who die from opioid overdose. But the striking result for me was that less than a third of those people who died from opioid overdose had any detectable naloxone in their system. And that was just another reminder for me that we need to continue messaging about opioid overdose, access to naloxone, the use of naloxone. Every time I see anyone with opioid-related problems in the emergency department, I try to prescribe and have it in their hands when they leave the door and teach them how to use it, because it's actually quite simple to use. It's Race, you were just showing the plunger, but it's available in nasal spray, and you just simply put it up their nostril and spray it, and it really can save a life that quickly.
Thank you. Yeah, that's really wonderful information. Hopefully, our viewers can find local resources, because naloxone is more and more widely available, and I think that that's a really good thing. And people can hopefully find agencies, different emergency departments, even health departments that are doing take-home naloxone distribution, which is supported by the state of California. Just to wrap up, you also mentioned xylazine testing and how that's limited. I think that's another challenge to this that viewers should be aware of, is that while most hospitals are able to test for fentanyl now, in fact, they're required by the state of California, that's not where we are with xylazine, and we're still struggling to identify every single person that may have xylazine in their system whenever we encounter them in the clinical setting. And that's where public education becomes more important, is to say we may not even know all of the patients that are encountering this drug at this time, just because the testing is still not where it needs to be.
That's right.
Any other last thoughts while we wrap up? I know this is a big topic, but we've learned so much. Thank you, Dr. Moriguchi and Dr. Rangan. I'll let you close with any other comments that you have. Thank you so much.
Yeah, I think the last comment would be that opioid addiction is treatable. We see people with opioid withdrawal, and we can treat them. And so if you have any questions about treatment, you can call the hotline. You can come to emergency departments, and we're able to treat you for that. And I just want you to know that there's hope at the end of the line.
That's a great message to end with. Our toll-free confidential hotline is always available for all callers, 1-800-222-1222. We have experts in pharmacy, toxicology, emergency medicine standing by to help you with any of your concerns or questions related to xylazine, fentanyl, opioid addiction, opioid recovery, really anything that's on your mind related to this topic, we're happy to help answer your questions. Thank you for joining us, and thank you to our featured speakers, Dr. Moriguchi and our co-host, Dr. Rangan, for another session of Close Calls with California Poison Control. Have a great afternoon.
Thank you.